Good morning. Thank you, Leila. I think Team Gorgeous label is just never going to go away. Maybe I shouldn't have said it. So I want to start by just thanking the organising committee for the invitation. I'm really, actually I can't see you guys, it's interesting lighting. I'm really humbled and honoured to give this lecture today and tell you a little bit about some of the work that we're doing in my lab. It's a little bit north of here, it's at Brisbane, University of Queensland. The title of the talk is here, it's Catching and Reading Single EVs One at a Time, Some Novel EV Nanotechnologies in the Clinic. So my background's in physical chemistry. I've got to start with a confession. My confession is, it's an EV conference. I'm actually not an EV guy. I feel a little bit uncomfortable. Like I said, my background's in physical chemistry. Our lab is a highly multidisciplinary nanoscience, nanotechnology lab. And a couple of years ago, we weren't actually in the EV field. And I want to start with a sincere thank you for two scientists that I really respect very much. They're here. Andreas Moller, who's here at this conference, now at the Chinese University of Hong Kong, and Associate Professor Michelle Hill, who's at UQ, although she wears a number of hats. They really gave us the vision, the wisdom, and the drive to get into this field. They posed a lot of problems. They really challenged us. They convinced us, if you like, Andreas, this is for you, that EVs are gorgeous, right? So that's how we got into the field. And much of the work that I'm going to present today, and we've collaborated with both of them, much of the work that I'm going to present was nucleated from those conversations. So thank you so much to Andreas and Michelle. I want to thank my lab before I start. This is the lab. I think the joke here is, the joke. This isn't the view from our lab, but it's actually not very far from our lab at the University of Queensland. So please come visit us. Come surf with us. We'd love to have you. We're always interested in new ideas, new collaborations. We have three, and these are the most fantastic people I've ever worked with. I'm just so humbled to work with them. It is the greatest pleasure every day that I go to work. But three of them are here at the conference, and I'm going to name them so you can seek them out and please harass them. Dr. Richard Lobb, who's just won an investigator fellowship, Zhou Zhu and Shuming Ni, brilliant PhD students. All of them are either speaking, you saw Richard at the debate yesterday, they're also presenting posters, and so please seek them out. Please see their posters, I'll try to point to them, harass them. They can explain the things that I'm going to wally in this presentation. They've got much deeper knowledge than I have. So let's get into single molecule readout technology. So I'm going to start by saying there was a great debate, apart from the gorgeous debate, there was a debate about bulk analysis versus single EVs yesterday. It was a great debate. Let me tell you where we sit on that. I'm going to show you some new technologies that we've developed and our experience of using single EV readout in lung cancer, melanoma, brain cancer, infectious disease, monitoring the immune system, all points to the same thing. This is the conclusion of this talk today, that single EV readout really matters, particularly in this space of immense chemical heterogeneity. So that's the nub of the talk today. So what I'll do is I'm going to start by showing you the first single molecule reader. It's going to be in cytokines, and then I'll pivot to EVs. So bear with me a little bit with cytokines. So this is how we first got into the field. We started having conversations with Andreas and Michelle. So this is a technology that we published a few years ago called the Immunostorm chip. It's a single molecule, single cytokine reader. And we developed this because we wanted to measure, we're challenged by clinicians to measure immunotoxicities, cytokine storms, before any other technologies could detect them, and then maybe get some mechanistic insight as well as potential clinical applications. I do need to acknowledge immediately the two inventors, Junrong Li, who's now a professor in China, and Elaine Wutrecht, who has just won a second investigator grant. Really proud of both of them. So the core technologies here, I'll keep it really simple. Basically, it's just a little nanocube. It's a chip, but it's a cube. The power of it is this device. It's a nanoparticle. It's a superplasmonic nanoparticle. Basically, what Junrong invented is a way of synthesizing a gold-silver alloy where you get little nanocubes inside of nanocubes. Now, why is that important? And I know that there are SIRS people in the audience, they would know this much better than I do, but when it comes to making really, really bright particles in Raman, you need a lot of edges. That's it, that's the physics. The electromagnetic wave gets, it resonates, it gets amplified, you get a bright particle. How bright are these particles that Junrong invented? They are orders of magnitude brighter than any other particle in this space. And why is that important? It's important because with conventional optical equipment, an optical microscope, and you're going to be seeing heaps of that today, or even an iPhone, we can detect a single one of these particles. Why is that important? Because if I can see a single particle directly, I can see a single molecule or a single EV directly. And that's the core of it. If you get that, you'll get the essence of the whole technology. So more than that, it's a sort of a catch it, see it, count it. And in the moment, I'll explain how we do catch it, see it, check it again, then count it. That's the core of the whole theme today. And so the way we do that is we coat this particle with a barcode, it's called a Raman reporter, and a unique antibody. And then you can multiplex it, and then you can catch it, see it, count it for numerous molecules and scale that up into millions of molecules. This is what the technology looked like, the original technology. And so the particles are the heart of it. However, we just make a chip. It's a tiny little thing. It has millions of nanopillars. And on each nanopillar catches one cytokine molecule. And in a moment, you'll see it catches a single EV. How does it work? I'll just walk you through the protocol. It's a remarkably simple protocol that uses very little sample. That was another requirement. So you get blood plasma loaded with the cytokines. They're the text messages for the immune system. We mix it with our barcoded particles. This is the signature for the barcoded SIRS signature for each of these barcoded particles. It's multiplex, chasing different cytokines at a time. You mix these together, put it over the chip, and just rinse. And so the way it's set up, because there's a Poisson dilution here, each pillar has all 4 of the antibodies for these 4 cytokines, right? So particles multiplexed, and the pillars are plexed, and then it's spatially constrained. So when you do this, what happens is that on every pillar, either one of 2 things happen. Either you have one particle and one molecule, or no particle and no molecule. So the bioinformatics is really simple. So we represent these fingerprints here as little red dots. So 2 red dots are 2 cytokines, et cetera, et cetera. The bioinformatics is very easy. You just count the dots. It's like an abacus. That's the core of the technology. And I'm going to be showing you lots of data with these slides. Wanted to make sure you understand how it works. So technology is a technology. It's not interesting unless you can get into the clinic. So where this really came alive is when we went into the clinic. The model that we used here to start with was the one we were challenged with. It was advanced melanoma, where patients that were about to die were given a radical treatment of immunotherapy, and that could save the lives of those patients. However, for something like 70% of those patients, they would get a cytokine storm, which would over-rev the immune system, damage organs, and could kill the patient. So we were challenged, can you detect that? Can you develop a technology so sensitive that it could detect it before any of those things happen, and also give us some insights into that cytokine storm? And so this is just some of the data. There are dozens of longitudinal patients. The other key point I need to make here is, because we're now counting molecules one at a time, this technology is about 1,000 times more sensitive than conventional methods of reading this sort of information. And it's also not prone to crosstalk in the way that you see when you highly multiplex things, because antibodies, they should be monogamous, but they're not. And these problems become difficult when you get into extreme trace situations, as we're going to go in a moment. And so as we push this into the clinic, you can hopefully see this. This is just one example of one patient undergoing advanced immunotherapy. This is day 7, day 21, and day 42. Very simple bioinformatics. We're going to see a lot of these slides. Not a lot of dots, which means not many cytokines, not much activation of the immune system, not a lot of dots, and then wham, day 42, look at all these dots. This is detected several weeks before there are any symptoms or any other technology could detect that overstimulation of the immune system, which is deadly. This is one example. We now have dozens. We have a long COVID system coming up where, this is under review at the moment, where we have run hundreds of patients. It's now up to 250 patients that have been run here longitudinally, and it is remarkable what this sort of sensitivity, single molecule sensitivity, allows you to do. You literally go under the carpet, and we've run conventional technologies in this paper and the one that's just in preprint at the moment under review, and conventional technologies don't see a signal. These highly sensitive, highly specific technologies do. All right, so let me now pivot to EVs. That was the core technology. So the breakthrough for us was to pivot this into single EVs. And I think at the ASF meeting a few years ago, I just presented some preliminary data, but this has now really exploded for us. So the idea here is if you can catch a single cytokine, catch the text messages, let's look at the emails. The emails are the EVs. So in this situation, what we do, and we change the technology a little bit, where we now use multiple antibodies that are specific to a particular tissue type and mechanism to catch a specific type of EV, and then so one EV, one pillar, single EV. Every pillar has either an EV or it has no EV. Then we add more. We use our barcoded particles now for what they're really designed for, to bind to and read out the protein barcode that exists on each individual EV. So what happens when you take this into a clinical model? Well, it was remarkable. Again, we started seeing the same sort of under-the-carpet sensitivity and clinical signal that we would see with the cytokines, but now with EVs. And so this is the first example, is a lung cancer example. And in lung cancer, don't have time to go into details, you want to catch it early, but once you catch it, the pesky problem is to distinguish between malignant and benign lung cancer. And here, again, you see it straight on the curve. This is healthy, benign, malignant. Not a lot of dots, a lot of dots. The ROC curve is really matching here. Again, this is limited clinical studies, but they're enough, they're powered, are matching the cutting edge technologies which are imaging. The problem in the clinic is you look at these dots, okay, this CAT scan, is that dot all that different to this dot? And is that glucose in the PET burning a bit? It's hard. A simple drop of blood with this sensitive and specific EV analysis is able to resolve that clinical signal. I'm going to dive a little bit more deeply because I want to now dive more deeply into the technology to show you what the unique features are. And then I'm going to move to further clinical models to see what happens if we go into melanoma and brain cancer. Specificity in highly chemical heterogeneous systems is a really, really big deal. So we wanted to use these systems to see whether we can amp up the specificity, just keep building multi-layers of specificity. So we started to call this multi-factor authentication for single EV analysis. In other words, it's not enough just to catch that EV. We want to check it again, check it a couple times before we're allowed to count it. And so I think we're all familiar with the IT security paradigm. You want to log onto your computer. Well, that's not enough. That's one level of IT security. There needs to be a connected but orthogonal, separate check, which is on a phone. And if both are correct, then it's verified. Then you can access, then you can count. So in the system I just showed you, invisibly what's actually been going on and designed is that there's 3 factors of authentication. The first one, as I mentioned, we choose very deliberately. In fact, we'll run a discovery program so that we know which particular surface EVs are enriched for those tissues. We program the pillar to catch with multiple antibodies. One can be used, but often is not enough. But that's just one layer. The second layer is then to target cancerous or interesting mechanisms on those EVs, which is the second factor. That's not enough. Check again with a third factor. If all 3 are there, then maybe that's a tick. And that's what we think gave the interesting results in that previous paper. But you've got 3 factors. Why stop at 3? Why not go to 4, 5, 6? Well, you can. How do you do it? So this is the next technology, which we didn't present at the ANZ meeting. So here, what we do is we change the design. We use a little bit of physical chemistry. The pixel now is electrically activated, and we stimulate the pixel. We use a ring chip. These are individual pixels, and we stimulate it with a low voltage AC field, which stimulates something we call nano shearing. You get fluid flow right near in the nano domain, and that basically strips off low binders, weak binders, and leaves behind its sieves, strong binders, that's what we're targeting, from low binders. And that's something that confounds much analysis. And then once you've done that, that's the second factor, first factor, second factor. Then we do the other two as third and fourth factor. That we find is another way to accentuate the signal. But why stop at 4? We just published this paper last year where I mentioned that antibody problem of antibody crosstalk. It's not talked about very much. The way to get around it is multi-factor authentication. Don't just rely on one antibody binding as something that's going to give you a specific result. So we built here, and I don't have time to talk about this technology, but we're integrating this as well. We use yeast, programmable yeast nanofragments with multiple antibody fragments or affinity binders, which can be used on both sides. That really lifts the game. So the key message today is this multi-factor, single molecule, and then multi-factor authentication is a really great way to enhance your specificity and trace level analysis. So I'm just going to quickly go through that AC mixing to give you the background, but I'm going to try to move through this quickly, and I'll acknowledge Kevin Koo and Shivashish Day, who did a lot of the initial work. And here, this is just initial work that shows that when you build these ring chips, apply an AC field, you generate these vigorous nano tornadoes right there on the pixels. They're a really key component of what makes the system work in the clinic, we believe. In fact, you can play with this a lot here. Kevin and Shivashish have used DC pulses to even lyse cells as they come by. The physics of this we initially explained quite a while ago. It's changed a little bit, but I'll just give you a quick insight. It's worth knowing because it differentiates this approach from conventional microfluidics. This is very, very different to conventional microfluidics. The way it works is you can have any geometry that you like. We're going to see lots of different geometry. And what you see is always a small electrode and a large electrode. When you apply an electric field, the counter ions move a little closer to the electrode, the co-ions move a little further away. And so there's a very thin layer that's called a double layer or a Debye length. Apologies for the equation. It's very thin. It's less than 5 nanometers in size. For blood plasma, it's about 1 nanometer in size. All the forces, I won't go through it, but the force operates in the same direction for one polarity and the other. That's why it's called electrohydrodynamics. Operate within that 1 to 5 nanometer zone. In conventional microfluidics, that's stationary. Nothing moves at that interface. You get what's called Poiseuille flow, where if you've ever stood next to a river, at the bank, nothing moves, all the motion's in the center. In these systems, the engine of the flow is nano. It's vigorous, and it's right at the interface, and we can control it. It's a key factor of what makes this work. Here's a video. I'll just skip through it. Just shows you how vigorous this is. That's simulated blood with a low voltage 10 kilohertz field. You can see it move. For the physicists in the room, this is not capillary phoresis. This is AC electrohydrodynamics. A little video. This is a tip that we used before, a chip we used once with tips. You don't need the tips. The antibodies or binders are here. This is showing how we would capture CTCs, rare CTCs, but replace the CTCs of blood with EVs, and it's the same process. And again, you can see we're playing with different geometries. This is the preferred system that I just described, we published earlier. So what I'm going to do now, having described the technology, is I want to multi-factor authenticate this approach, single molecule with the multi-factor molecular. I'm going to use multiple clinical models. Let's see what happens when we look at different clinical problems. And again, in case I run out of time, I'm going to start with lung, melanoma, brain cancer, immune system, and wrap up. Let's see how far I get. So we originally started, this is a collaboration with clinician Peter Sawyer and Mitch Stark, who's also just got an investigator fellowship. Congratulations to Mitch. Here's our system, just explained it. The first question we asked, which is in this paper, and I'll rip through it, is can we detect melanoma early? Can we detect stage 2, maybe a bit of stage 1? And the answer is we can. The sensitivity and specificity of this EV capture gives us an accuracy of 95% published. Again, limited clinical trials. As you go to larger numbers, it may drop a bit, but this really encouraged us. It pushed us to a much more interesting question, and this is in collaboration with Jonathan Sabon and Andreas Brenner at the Olivia Newton-John Cancer Centre. Can we track the disease and the immune system in real time? Can we get eyes on these processes, on the cancer evolution and the immune system evolution in real time? The details are in these 2 papers, and the answer is we can, and the results, at least in my eyes, are incredibly fascinating. I don't have time to get through all of it, but I want to give you some of the highlights. The highlights are we use this technology now to simultaneously measure EV phenotypic evolution for key EVs. At the same time, we measure, which is in this paper, and we measure CTC phenotypic evolution head-to-head. The EV information, in my view, is more informative. It's incredibly exciting. Here's just a little snapshot of one patient. This is a patient, advanced melanoma patient, undergoing precision treatment. Here you can see, here are the 4 subclones. They're diminishing during treatment. And what happens is that, and we've got the cytokine data on the same samples that I just showed you. What happens is that the patient gets side effects, and because of those side effects, the clinician, Jonathan, stops the treatment, right? Otherwise, there are dangerous immune side effects. And look at how the subclones jump up, in particular the LNGFI, that's a cancer stem cell marker. You don't want this in your blood. Jumps up immediately after the therapy has ceased, and the patient tragically dies. So, Jonathan with us got quite excited by this, saying, gee, this is all retrospective. Wouldn't it be great if we could envisage a future where these types of approaches are used to guide therapy? So if he saw that the therapy was working, he'd hang in there with the therapy, take the hit with some of the minor effects, or flip the treatment. I think that will be the future as we get better and better eyes on these diseases. This is some work that Joe Su will be presenting in a poster this afternoon. Please go and see Joe. I might just skip this in the interest of time, but Joe has reprogrammed that 3rd and 4th authentication to now ask the question, can we watch the endothelial mesenchymal transition using these EVs in real time? The answer is you can, and you can stratify the diseases into these. It's quite interesting. Please go and have a chat to Joe. So let me now pivot to what we thought would be, we started this about 5 years ago, what we thought to be the hardest EV problem that we could imagine. It's brain cancer, and I want to acknowledge immediately the leadership of Richard Lobb, who's here, and Zhen Zhang, who started this with her PhD and is continuing. We wanted this to attack a debate that's been going on for quite a while, which is in brain cancer, glioblastoma, which is one of the worst brain cancers. Don't have time to describe it, but it's a horrible disease. Everyone that gets it pretty much dies. Survival rates are 9 to 18 months. It needs help. The hypothesis was, and there's still a debate on this, are EVs transported from GBM into blood? So we wanted to ask the question, could we use this single molecule approach, multi-factor authentication, to add to this debate, find new data? So 5 years of work. We first ran a discovery program. This is currently under review. Hopefully it'll come out soon. And if anyone out here is a reviewer, please be kind to us or come talk to us at the bar. Yeah, we'd love to debate it. So we ran a comprehensive discovery program and found these 2 markers to be quite specific for astrocytes. In other words, they occur in astrocytes and they don't really occur anywhere else in the body, and they're on the surface of cells. And then we proved that, or we demonstrated that they're on the surface of EVs. We've run this in collaboration with the Mark Hughes Foundation for 35 pre and post GBM longitudinal patients. We've validated this on GBM cell lines with Brian Day's lab in QIMR. We have immunohistochemistry analysis on 35 tumour tissues and a whole broad range of other tissues. And along with this, thanks to Mark Hughes Foundation, we have MRI imaging right along with this. So I don't have time to go through all the details. This is just a quick slide. Again, Richard will be presenting this as part of his poster this afternoon, so I'll defer to Richard. So here's the chip all described. So the dream run would be that we would see all these patients get an operation, the aggregate EV load drop after surgery, and then it may come back when the disease regresses, right? So I'll show data in a second. Just one quick point on the diversity of GBM. One of the reasons GBM is such a killer is that it's so heterogeneous and plastic. There are, as currently theorized, 4 main subclones, each with these key markers. So that's a gift for us. We could program our chip with those 4 key markers and watch them in real time as during therapy, which is what we've done. So here's just a small example of the data, but it certainly got me excited. Here acknowledging Mike Fay, who's the director of the Mark Hughes Foundation Brain Cancer Centre, and Paul Tui at Newcastle, who provided all the samples, all the clinical data. So here's just one patient, and I get electrified whenever I see some of this. This is real time. This is a real-time window, we believe, into the brain. Here you're seeing the aggregate EV results, and then look at this jump up just before radiological recurrence. So just before the MRI picks up the dot in the brain, signifying that the cancer may have come back, we see it in the blood through the EVs. But better than that, when not just looking at the aggregate results, we can now use the chip to disassociate all of the subclones and see each of these go up and down, and which one is gaining advantage. In other words, which one would you want to hit with a therapeutic? So here you can see, in this patient, the CD44, the mesenchymal clone, is gaining an advantage. There's so much data in this, there's so much in this paper. Please have a chat to Richard. Each patient is absolutely fascinating. We believe it's a possible window, new window into the brain, enabled through this high specificity analysis. The other highlight, and I won't dwell on it, is if you look at just the aggregate survival data on these chips, we can very easily resolve those patients who will live longer and those who won't. Again, we hope, we dream that some of these approaches might be used to help guide the therapy for these patients who desperately need new approaches. In other words, seeing which bad actors are coming up in their brain and hitting just those. The next one is, as well as the hard problem of GBM, the other area we really want to look at, we acquired, I'm going to say this, a really brilliant PhD student, Shuming Ni, who was naive. She's here. She's gave a poster yesterday, but please go and harass her. We convinced Shuming Ni to take on an even harder problem, which is, well, if we can catch EVs from GBM, can we catch EVs from the brain's own immune system, the microglia? Don't have time to describe the details of it, but there's a lot of debate about how this works. The microglia, macrophages, and they're principal components of the immune system in the brain. They're very involved in the evolution of GBM. So we've just published, and this is what Shuming presented, this paper where we started in the same way as we did with the GBM. We started a comprehensive discovery program to discover unique proteins on the surface of microglia, only on microglia, that we could use our technology to hunt for in the blood. So this is the paper. It's just come out, and Shuming and Richard have found a range of these, and yes, we have already reprogrammed the chip. We're running samples. We're not ready to give that data, but maybe in ICEF 2025, I'd recommend Shuming Ni as a potential speaker to report on our results. We can't wait for the results. Our dream for this is to have a chip dashboard, a brain immuno dashboard, where this specific approach gives you a dashboard in real time of the EV subclones for the cancer and also of the immune system in real time as the two interplay to guide therapy. I might move through this as well to save a little bit of time. This is Joe Zhu. I mentioned, and Richard, who are presenting a poster later this afternoon. With this approach, you're not limited just to look at protein signatures. So this is an approach currently under review where Joe is using, rather than antibodies, he's using a series of lectins and antibodies to probe specific glycosylation signatures on the surface of EVs using a combination of affinity binders. The data, in my view, looks really, really interesting. This is some of the RRC data. It is actually better than the lung cancer data I showed earlier looking for proteins. So in the future, we would perceive, why not have a chip, a proteoglycode chip that reads all of those and makes it even more specific, more informed decisions about therapy, et cetera, et cetera. So I think I've got a little bit of time. I want to, okay, I've got the thumbs up from the chair. I can relax. Plenty of time. I might go back a few slides. I'll give some Team Gorgeous quotes. That's what I could do. So I want to just pause for a second and change direction. So far, I've talked only about reading, catching, and authenticating single EVs, making sure that they're the ones we're after, and then specifically reading the protein signature or the glycan signature on the outside for a range of diseases. But what about the cargo? Let's not forget about the cargo. So once we've caught them and authenticated, can we bust them open and look at the cargo? So we can, and the place we wanted to start was to look at the phosphorylation state of the proteins that we've captured on the inside of the EVs and also on the surface. Why? So this is a review article we published a little while ago. The bottom line is that in cancer, 70 or 75% of all drugs, precision drugs, target phosphorylation sites. But in the clinic, we don't look for those. We have no technologies to look for those. We use sequencing, if you're lucky. But these are post-translational translations that are invisible to genomics. So we argue that these are, let me give you a physical chemist speak here, these are phosphorylation pathways going on inside the cancer, inside the cell. They're like the Google traffic maps, and we need to know which ones are being driven because that's the drug you need to give to block that particular pathway, knock out that subclone, or multiple subclones. There's no way to visualize that. So we developed the next generation of the technology to catch, check, read, but then basically bust the EV open, bust it open. The protocol I'll show in a second. These are some of the initial publications to read the phosphorylation signature of the individual proteins, and I'll explain you how we do that. Basically, we use a very simple physical chemistry trick. I think it's here. Yeah. The physical chemistry trick is that as the captured proteins phosphorylate, they just get more charged. They get significantly more charged, so they have less binding, physical binding to a gold surface. A very simple, phenomenon, and we can actually calibrate each one of these pixels and quantitate it's not perfect, but it's remarkable what you can achieve. We can calibrate for the degree of phosphorylation for each protein, and then we choose for lung cancer all of the proteins that are the core driver mechanisms for lung cancer, and each of these are kinases, they're all druggable. You just need to know which drug to use and when. So the dream was then to use the chip, everything in the kit bag, to develop a phosphorylation heat map, and I'll skip through this quickly. Here is the result. It's came out last year, but really excited by this, really proud of this work. So here you can see straight away this is the phosphorylation heat map for all those key mechanisms in lung cancer. You can clearly distinguish the healthy from the lung cancer patients, but that's not the interesting bit. The interesting bit, I think, is that every patient has a different phosphorylation signature. Every patient is unique. It's the heterogeneity of cancer lit up. Every patient is unique, and they've got different Google Map highways being blocked. And so they'll need specific treatment to block those particular. So what happens when you block those patients in real time? Well, we can track those as well. And here's just some of the data. This is under review at the moment and about to come out, we hope. So this is in collaboration with Ken O'Byrne, an oncologist at TRI, QUT actually, Elaine Wutrecht and Abu Sinna, an enormous of years of work. Here's just some examples of patients, their phosphorylation heat maps in lung cancer before and after immunotherapy. You see all the subclones change. It's absolutely fascinating. The key shot here, it takes a little bit to describe, but I might just describe it if I may. Yeah, great. So in lung cancer, if a patient has lung cancer, Immunotherapy is a revolutionary approach, but not all patients can get lung cancer, can get immunotherapy, I'm sorry. The current clinical practice is to get a needle, shove it into the lung, forgive the physical chemist speak, get a chunk of meat, and do immunostaining to see the PD-L1 status, right? So what we did is we challenged that by looking at the phosphorylation of PD-L1 in the EVs that we captured on our chip. And this one really knocked us off our chair. Look at this. It's a wonder. It is literally, I haven't seen a correlation like this in the clinic before. It's almost a one-to-one correlation between this molecular signature that we see. It's a phosphorylation of PD-L1, and it's a fascinating story about why it's phosphorylated, of PD-L1 on the EVs that are captured versus the biopsy results. So, an argument here that Ken puts is that maybe this simple blood test could be used rather than the painful and sometimes inaccurate biopsy. All right, I'm going to pivot on, I've got one last slide if I can, and then I'll conclude. Can I make it? Great, fantastic. So I want to say something about the future of where we're going in our lab. So we've put a tremendous amount of effort over the past several years building these chips, these nanosystems to catch, interrogate, check, and count and manipulate EVs in clinical samples. And so we thought, well, if we've done that, why don't we take the next step? Can we use these chips to actually manufacture with precision the EVs? So now, rather than reading them, can we make them, and can we make them one at a time? So this is work from two amazingly brilliant young scientists, Fiak Antow and Shivashi Day. This is the first schematic of the way we'll do it. We're very, very lucky. We've just been funded. It started this year. It's a 5-year ARC-funded program to create, via these sort of mechanisms, on-chip nanomanufactures of EVs one at a time. And the goal is with absolute precision, where we know every single chemical that goes in here, every lipid, every protein, every piece of cargo will be assembled on these systems, and then we'll use electrical stimulation to fold this up into precisely controlled EVs with exactly the right size. Now, how will we QC this? How will we know it's right? Well, we're lucky we've just built all the chips to read these EVs. So this will plug right into, we're leveraging the previous work, and it will plug right into the interrogation system. So the main announcement, and this is an absolute, I'm going to finish with an absolute blatant advertisement, if I can. We've just started this 5-year program. We have 4 PhD scholarships available. We're really interested in young people. If you're interested, please come and have a chat with us. What UQ does at the moment, for reasons I don't understand, have a bit of a focus on domestic students, but we're really interested in bright people who are interested to work in highly multidisciplinary environments like this. Okay, let me conclude. Am I okay with time? Great, fantastic. So I hope that in the last few minutes or so I've managed to describe several new single EV readout technologies that we've developed. And it's not just enough to catch that molecule. You've got to catch it, check it, sieve it, check it again, check it lots of times before you count it. And there's a real advantage to counting it directly rather than using amplifying methods like PCR, et cetera, et cetera. So the multi-molecular authentication methods, we believe, enable enhanced specificity for trace EV analysis and schema like blood, where it's critical, and for incredibly difficult problems like GBM, where there are so few EVs that get through into the blood. We believe these sorts of technologies could give new clinical insights into lung cancer, melanoma, GBM, and we're diversifying now into other clinical areas where we can help. We have an NHMRC synergy grant in psychology, so please watch this space. We believe the capture of brain EVs could provide, I've said this before, a new window into GBM and possibly the brain. We're exceptionally excited about this new way of catching brain-derived EVs. We can also bust these EVs open. We can read the phosphorylation state of the captured SEVs on the chip. And of course, I've mentioned many times the clinical applications for cancer detection, therapy monitoring, and guided therapy. And a little poster child for the future, these similar chips can be used for single EV manufacturers. So please watch this space. I want to finish by just once again deeply thanking our lab, just an amazing group of people. Please talk to Richard, Shiming, and Joe. They're here. Harass them, challenge them with ideas. Carlos Gallo and Joy Wolfram at UQ have asked me to put up, I'm just going to, before I go there, Carlos, I'll just acknowledge our own funders, rather. So I deeply want to acknowledge our funders, primarily the Australian Research Council, the NHMRC, but really Evolution Mining has supported us, and the Mark Hughes Foundation for all of the brain cancer work. Deeply grateful to them and the CSIRO. Joy Wolfram and Carlos Gallo, who's here, have set up a new centre at UQ focusing on EVs. So a plug, Carlos, for you. Please talk to Carlos about this. It's bigger than Ben-Hur. It's going to be fantastic, right? Now you owe me a beer, right? So I'll go back to here and conclude. Thank you so much for your attention.